As the government is set to announce the easing of COVID restrictions tomorrow, it appears mandates will stay for those who are working with our most vulnerable. The aged care sector is suffering a major workforce shortage, and it's one of the most pressing issues facing the new role of Aged Care Commissioner. Carolyn Cooper has just begun in the job. She joins us now. Good morning, Carolyn.
Morena.
So a week on the job, but there's already going to be some big changes or some things that will impact, I guess, the aged care sector, in that with borders opening up and potentially passes going, are you concerned about the impact that that could have on our elderly population?
Look, I think we do have to be very careful when we're looking at changes with the mandates that will affect vulnerable older people. But we have had a number of things in the toolkit, and now we have a really highly vaccinated population. So things are a little bit different, but I am very cautious about that, yes.
Have you given the government any advice on what you feel should remain in place or go in terms of mandates and restrictions for elderly?
No, I haven't, Melissa. I started in my role last Monday, so pretty much last week I was just learning a little bit about the Health and Disability Commission and actually starting to get to grips with what the role will be about. So no, I'm not in that position yet.
And you said that there should still be some caution, of course, around our vulnerable population. Where do you strike that balance, though? Because obviously the restrictions are there to keep them safe in terms of health. But what about the impact on their quality of life and mental health? You know, a lot of them have not been able to see or have visits, regular visits from their families.
Yeah, I think you'll find that most providers are actually trying to have access for visiting as much as they can. They need to manage the risk because they don't want to, expose those vulnerable people to more risk. But if they can, they will actually ensure there's visiting. It might be restricted times. It might be, you might have to have a RAT test before you go. There might be limited numbers. But most providers are actually doing something to try and make sure that that happens. And I think, that's the right thing to do. And there is access for people on compassionate grounds, and that has continued right through, even when we were in lockdown, there was still access on compassionate grounds.
Are you concerned at all? Is mental health an issue that you are concerned with in the elderly population?
Look, absolutely. We know that for older people, their loved ones are an absolute source of joy, and so it is really important to be able to get access. I know providers are actually trying to use technology to allow some access as well, but that is a bit challenging at times. And, it is the best thing is for people to get together and actually enjoy their time.
We are hearing that around 110 aged care facilities approximately have active COVID cases. Are you satisfied that infection prevention and control is at an appropriate level?
Look, the Health Cert, who are the people that actually look at the certification around this sort of thing in the Ministry of Health, they may be doing some practical checks around that. But I know that providers, from my experience, are quite experienced with infection prevention control. As you may be aware, in aged care facilities, there are other times where there's flu outbreaks or there's various different things like norovirus, that sort of thing. And so aged care facilities are actually quite used to being, in putting people into isolation, managing them really well, making sure that the infection prevention control is, well managed. But I can't speak for all of the care providers. There's 650 aged care homes in New Zealand, so there's a lot of people to look into.
It is. In terms of number of people, though, how dire is your staffing issue? I understand around 20% of the workforce you need to fill.
So the aged care providers are struggling with the workforce, absolutely. And I think New Zealand, the health system workforce is a challenge. But I would say that, it's mostly nursing. There is some areas of the services that are challenged as well, but mostly nursing. So the 20%, I think, is in the nursing area. So that's about 1,000 vacancies in the aged care sector. And that's a massive, massive issue. And from my perspective, my role is to ensure that the care and protection of older people is actually at the foremost for providers. And if they don't have a workforce, that's pretty challenging. But I won't be, reducing my oversight to take that into account, unfortunately, because the older people still need to actually have the care that they deserve. And, the balance between quality of care and quality of life is critically important for older people.
Yeah. And I imagine that spills over into home-based care as well, that would impact people who need to be seen in the community. Aged Care Commissioner Carolyn Cooper, we have to leave it there, but thank you very much for joining us this morning.